Afternoon, everybody. So if you look around, things look a little different already. I don't have General Higer here. So today, from the wing, you've got me. This is the first time we've done a town hall in 2 weeks. We moved to a Friday-only schedule, if you remember. We moved from that 3 town halls a week to just the Friday schedule. And as part of that, we also have medical here. So here in a little while, we'll start with the Q&A session. And so if you look at that text number on the screen, go ahead and start texting in your questions, and we'll answer as many of them as possible. But one thing we wanted to do a little different, like I told you, General Higer and Colonel Gordon, they won't be here today. Again, you just got me. But we brought in Master Sergeant Stewart. And so Master Sergeant Stewart has an interesting story, and I wanted to give him a chance to tell his story. And then from there, we can ask questions. You can ask me questions about wing stuff. You can ask Sergeant Stewart questions about anything he discusses. And you can also ask our medical team any questions about public health or medical related situations you may have. So first off, I want to ask, hey, Sergeant Stewart, welcome. Appreciate you coming.
Yes, sir.
Where do you work?
412 MXS.
Okay. What do you do there?
Assistant superintendent.
Okay. How long have you been here on Edwards?
Since January, so 5 months, 6 months.
Where'd you come in from?
Fort Worth.
Fort Worth?
Yes, sir.
Oh, that would have been nice. Are you
awesome.
a Texas person?
From Louisiana, sir.
I like Fort Worth. So my family's all from Dallas, Fort Worth area, and so they don't have any chief spots over there. But
They don't.
No, not that I know of. I'll go there in a second, though. So one thing, I'll bring it up. So when everything started with the COVID situation in March, it took us a little while on Edwards before we had our first positive case. And I don't know if are you famous because of it? But you were our first positive case.
I have the nickname Neo as being the one.
The one? So are you the one who brought it to Edwards?
No, sir.
No, I don't think so.
Not me.
People say that, though?
No, sir.
Okay.
They don't blame me.
You're just the one.
I totally stayed away. So that was a good thing.
No. So as you can see, we got Sergeant Stewart in front of us. He's doing fine now. But can you tell us a little bit about what happened and kind of your story with that whole situation?
Okay, so the wife and I took a quick cruise for her birthday. She was turning 40.
Where'd you go?
To Ensenada, Mexico.
Oh, nice.
So we took a quick cruise, came back Sunday. I can tell I was getting a little sick, throat was feeling a little scratchy, itchy. Next day, woke up, had full-on flu symptoms. I was shivering, had fever. I thought I had the flu.
Did it feel any different from the flu?
No, not at the beginning. It was the flu symptoms. Mm-hmm. So I was like, okay, I had the flu. So I took a bunch of Theraflu, different medicines that I had. And Tuesday, that was Monday. Tuesday, I came on base, went to sick call, and guy diagnosed me and said, hey, I think you have an upper respiratory problem. You know, take 2 days off, quarters, go home and get some rest, and, we'll see you a couple days. So went home, did that, started, eating soup and hot liquids and Theraflu, trying to make it go away. The next day, I felt a little better. I was like, okay, this thing is passing over me. Theraflu must be working. Wednesday, it felt like, or the Thursday, it felt like that was it. Everything was full on.
What do you mean?
It was the flu, not the flu, but the fever. I was sweating. I started coughing. Had lost of appetite.
So it felt different from your normal flu that you had a couple days before.
Yes, sir. I could barely move. It was. I don't know. It totally changed from Mondays. So called in, asked my OIC, could I extend my leave because I wasn't feeling well, didn't want to come into work. So he's like, yeah, take the time. And from Thursday to Sunday, it got worse.
Oh, even worse from there?
It got worse from there.
Wow.
To the shortness of breath kicked in. I was having coughing spells to where I would break out sweating. I was coughing so hard, and I couldn't catch my breath, so I'm dripping sweat. Couldn't sleep. My wife couldn't sleep. And this whole time, I'm thinking, oh, I forgot. I went to the emergency room that Thursday in Antelope Valley Hospital, and they did the same thing. They had me outside, diagnosed me with upper respiratory problem, and sent me on my way. Mm-hmm. So that whole weekend got worse. And this whole time I had COVID and I didn't know it. So I'm around my family, coughing and everything else. So Monday morning rolls around. I was like, I have to go to the hospital. And I'm not sure if that's when you guys gave me a call.
You mean by our public health or our medical team?
Yes, sir.
Okay.
So I called in and I told them, hey, I have shortness of breath. And it was like, go directly to the hospital. Don't pass go. So I was like, that's where I'm going. So I went to the emergency room and got admitted to the hospital. The first day was a long day.
Had they tested you for COVID yet?
No, sir.
Okay.
They didn't have any tests here.
Because, right, this was early. This was very early in the whole situation. This is March.
Yes, sir. So I think I was maybe the first or second case in the valley.
Okay.
So they had no tests. The doctor, he had to literally plead my case to the CDC to get a test. So I went 9 o'clock that morning. I think maybe 10 o'clock that night, they actually tested me.
What did they do, if you don't mind me asking?
Stuck a metal Q-tip down the back of my nose to my throat, and they swallowed my throat as well.
So I heard you could feel it in your brain.
It's terrible.
Yeah.
It's the worst. It was terrible.
Oh.
Next, I had it done twice.
Just to make sure.
Just to make sure.
Because your brain needed another. Oh.
So they found me a room. They had to find a room that had the air.
Oh, it had its own air conditioning to recycle,
yes,
so it
sir.
didn't spread. Okay, that makes
so
sense.
They had to find a room like that for me. So yeah, I went upstairs. Because we were there so long, they allowed my wife to stay the night. So the next morning, wake up, they were like, okay, ma'am, you have to go. So that's the last time I saw my wife for the next week.
Oh, wow.
Yeah, so the fevers got worse. They would come in and put ice bags under my arms and my armpits.
So you had a fever when you had the flu, when
Yes.
you thought you had the flu, and then you said it got worse over time. So what were you looking at fever-wise during that time frame? Do you remember, like, what were you?
It was well over 100, maybe 102. It was like sustained. It wasn't going down.
Oh, wow. So not that cycle that you normally see.
No, sir.
Okay.
It was just hot fever. And medication started, and that's the worst part of this is, like, since I was the first 1, 2, or whatever, they didn't have a proper, they didn't know what to give me.
Oh, yeah. The whole world, I think, was learning at the same time.
So they gave me everything.
Ah, okay.
So I was getting shots in my stomach. They gave me HIV, the medicine they give to HIV patients because they fought viruses. They didn't know what to do.
Okay.
And
ma'am, so do you know why they're doing that kind of stuff? We're kind of breaking into more medical discussion now, though. Was that because it's the immunocompromised type medication?
Yes, I'm like Sergeant Stewart said, it was mainly probably because of the virus, and they were just trying to throw the kitchen sink because they didn't know what the treatment would have been. Imagine, getting nebulizer treatments and steroids, possibly, and other things that may have happened at that time. I'm sure they didn't have a really good treatment plan.
No, that makes sense. Thank you, ma'am.
yes. And for that effect alone, I would say, please respect this COVID. That HIV medicine is the worst thing I've ever tasted. You have to, it's orally.
Ah, okay.
Yes. And my goodness.
No Jell-O.
It's terrible. It's the worst. I can't even describe it. And it's hot. The longer you keep it in your mouth, it gets hot. So, yeah, that was the medicine. I was getting all the meds. I was on my lungs. I had pneumonia in my lungs.
Wow.
So my lungs weren't producing enough oxygen. So I was on air. And it got worse the first 2 days. It's like I couldn't walk to the bathroom without like breaking into a sweat or just barely just getting there. It was crazy. And I work out a lot, run. But this virus, I lost 20 pounds in like 13 days.
Oh, wow. Have you been able to gain any of that back?
Slowly.
Okay.
Slowly. I didn't want to gain all of it back,
Of
so it was
course.
kind of a good thing.
Of course.
But 20
not-
pounds was
not-
a lot.
yeah, you don't want it
And
that way.
Not that way.
No, not at all.
Yeah,
So how long were you in the hospital for?
for 7 days.
And then when you came home, were you good to go? You woke up one day, set day 7, and healthy, feeling good?
Well, day 5, they still hadn't got the test back. So they got the test back around day 5. And luckily I had my phone with me. So I found out through Carnival,
The cruise.
the cruise line,
Okay.
that I actually had it before the doctor told me. Because Carnival sent out a newsletter to pretty much everybody who was on that cruise saying a member tested positive.
Ah,
So
okay.
I was like, I was like, that's crazy. You could have told me first. But that's the way I found out. And then the doctor came in a little later. So like, yeah, you tested positive. But by then they had emptied the kitchen sink.
Yeah.
So day 5, I was still getting a couple meds. Day 6, there was no more medicine. It was just, okay, you just have to, will yourself to get your lungs. So I had to walk around the room to try and build up some stamina.
So you're just rebuilding from scratch, basically?
Yes, sir.
Okay.
Yep, trying to breathe without the breathing, the oxygen.
Mm-hmm.
So, and day 7, they moved me to another room, I guess, to make room for some other people. And they were like, yeah, you haven't had a fever in 3 days or whatever. And I was like, all right, you cleared to go home. And I was like, see ya. Ripping all the stuff
I'm
off.
sure.
Call my wife and say, hey, you need to get over here quick before they change their mind. So, but when I got home that Friday, so I came home Monday, Friday, my wife went and got tested, and they all tested positive.
Oh, wow.
So the whole house, everybody had it, the whole house. So
Similar to you as far as symptoms and feeling?
totally
and,
different.
oh, really?
My wife and daughters, they only lost their smell and taste.
Oh, so they didn't go through the same, they didn't have the,
No fever.
and it's the same form, it's just
Yes, sir.
reacts differently in everybody's body. Okay.
Yeah. And I thank God that I had,
Of course.
had the strain that I did, because what I went through, I would never want to put my wife or kids through.
Yeah, I think much people, I mean, everybody would probably agree with you there. That's
And,
it's fortunate.
the fact of being in the hospital room with no visitors.
Mm-hmm.
Nobody, I shut the whole hospital down. I was like, they totally shut visitation down in the hospital. So to get nurses, you can't get any rest because they're coming in, taking your blood,
Mm-hmm.
checking your vitals, different things. All 24 hours you're there the whole day.
So you've been home for what, 3.5 months? 3
Yes.
months? How are you feeling now?
Great.
Back to normal?
Yes,
Breathing?
sir.
How's breathing?
This is good.
What about the gym?
I work out at home now because the gyms are kind
True.
of. So,
But are you feeling you got strength?
Yes, yes.
What about stamina, running, any of that stuff?
It's getting back there.
Okay, so you're not where you
I'm
were
not
before.
full strength as far as the breathing but I'm working on it.
Getting tired throughout the day, or is it just you can make most days
Yeah,
fine?
I can make most days.
Okay,
It's just
but
when
was it like that?
No,
What about a month ago, 2 months ago?
no, sir. It's been a gradual process.
Okay.
Yeah, it's crazy the effects this virus has on your body. I don't know. It tears you down, like literally.
I can't imagine. I can tell you from this side, you were March. Everybody knows March was a crazy time for everybody. There were a lot of things happening in the world and in the U.S. And if we keep going down the Antelope Valley and on base, and in everybody's family, that there were just a lot of things that everybody wasn't. No, I don't think any of us were prepared for, and we didn't even understand. We feel more comfortable now because we understand some things. But I was talking to the medical team. We're learning more every day about the virus and about its long-term effects. And we can only say long-term, and long-term is 3 months. That's all we know right now.
Yep.
And so we have no idea what 1 year is going to look like or 2 years is going to look like. I can tell you from this side, from the wing side, we weren't allowed to know all of the information. Our medical professionals knew, but there's HIPAA, and so we got to make sure things are kept. But we knew you, and we knew that you were there, and we knew that we were all very worried, but we couldn't get the updates we would get are things like things are the same, or things are a little worse, or things are a little better. And so we were rooting every time we heard things were a little better, and people are feeling better, and you're at home, and so we were waiting on pins and needles to make sure that you were all right, and then your family was as well. But it was a scary time for everybody then, and I think now it's still a scary time, but it just depends on where you are in the situation.
Yeah.
If we've got more and more people on the space that have family and friends, whether they're here in the Antelope Valley or somewhere else in the United States or across the world that now have the virus or have had the virus, and so they're all dealing with that at different times and in different situations, and so that's a hard one. And I haven't seen it get any easier. We're better at testing it. We're faster at testing it. There's all kinds of clinical trials and different things going out there where they're trying to figure out a cure, but they don't have anything yet. So it's still a scary time. And actually, we have way more people. If you look at the charts across the valley, Kern County, San Bernardino County, LA, they just keep going up. And they get little dips here and there, but they keep going up. And so it's not a thing, all of us wore our masks as we came in today. We only took them off, they're right here next to us or in our pockets. And we only took them off when we sat down, and we'll wear them on the way out. And so this is still a thing that's happening that we have to be careful and be very mindful of.
Yep. I mean, and for me, I don't know, like you said, we don't have enough information. I'm not sure if I can get it again.
Yeah. I've heard some people have and some people haven't.
It's a scary time. It's like, so now I'm even more protective of myself and my family. So that's why. So
you're saying even though you had it, I mean, you wore your mask coming in today. I saw you. Yep. Are you wearing that because that's a base rule, or would you be wearing that anyway?
Yes, sir. I wear it on my own. It's, self-preservation at this point is.
So you're not thinking, hey, you've had it, you're good. You can throw anything at you.
No, sir. Because it's not like the flu.
Yeah.
The flu is like, oh, you got it. You can catch it next year. But this is not the flu. It's way worse, and it's life-threatening.
Yeah. Well, so I appreciate. So I mean, we got Sergeant Stewart here, and Sergeant Stewart's being incredibly brave and transparent. This is his personal business, and so the fact that he's willing to come here and talk to us and really talk to you guys about his situation and what he dealt with. We really appreciate it. I really appreciate it. Another thing that Sergeant Stewart has offered to do. So we're gonna continue on and do the question and answer session of the town hall that you guys are used to doing, and we'll move medical in here. But Sergeant Stewart's going to hang out, and so if there are any questions that come through for him, if you want to know how high the fever was on day 2, he will choose to answer anything he wants to answer, but he's going to stay here and available for the rest of the town hall, just in case you have any questions. Sir, I appreciate you coming, and I'll talk to you after this whole thing is done. For everybody else, so, normally we've got the general sitting on one, and so you'll see the general, and he'll look very poised and eloquent as he's saying great things on camera. And while he's doing that, what you don't see is I'm next to him on my phone, digging on 2 phones, trying to figure out what everybody's asking questions about. And so instead, you get to see me do that at the same time. And so we've got public health with us, excuse me. We've got Sergeant Stewart, and so we're going to answer as many of your questions, but I hate to be rude, but I'm going to look down as we're asking some of these questions. So bear with me for a second. So the first question is, I heard Child and Youth Services would be releasing a list of which families they can accommodate. The list was supposed to be released yesterday, and it wasn't, is what this text is saying. So I can tell you that, yes, there is a list. Right now, there was a tentative list that went out to group commanders. And it wasn't here's who has spots and here's who doesn't, but it was a list of what they think their capacity is going to be. Now, remember, the FSS and the CDC are dealing with a lot of different variables. How many providers are they going to have? How many people are going to show up? What people need to show up? And so the group commanders started looking through the lists and prioritizing things based on missions they saw or forecasting what was going to happen, and then talking to the FSS about where they thought there might be issues. At the same time, FSS is working. Can we open up a new building? Can we put one extra person safely in a room in order to increase capacity? And so they're working very closely with public health in order to make that happen. I have not seen, so the list that they're talking about, I saw the initial one. Last I heard in the conversations we were having yesterday and Wednesday were the group commanders and some of the squadron commanders all discussing the prioritization and where they were going to have issues. And the group commanders owed the services squadron, so the FSS, their answers on where the issues were going to be. That way the FSS could work through it. So if there was a message that went out that said it was supposed to be available yesterday and it's not, I ask you again, be patient. There are just so many variables, and so they're trying to get that out as quickly as possible, but making sure they cover everything. Let me go on to the next question here. Sergeant Stewart, did you have any scarring on your lungs?
I don't think so.
I hope not.
I hope not.
Okay. So he's going to be off camera just because we're trying to make sure that we keep our 6-foot separation from all of our people. Okay. Okay, are we allowed to gather in groups of 10 people on base again? I can't find the stream from last. Okay, so there's not a rule that says, so there's this guidance from the DOD, and there's been events where we have more than 10 people. There's buildings where we have more than 10 people. If you look at the wing commander's latest guidance, he talks about some really key principles. If you had to have 10 people together, for instance, I was at a retirement not too long ago where we had probably 20 people in the room. Each person was at a chair that was pre-positioned at least 10 feet away from the other chair. Now, I actually had one person next to me, but that was my wife. We lived together, so I figure, we're okay, and it was the same way for everybody else. If you were with somebody who lived in your household, you were sitting right next to them. So we had more than 10 people in that room celebrating the career of this person, of one of our colonels. But we all kept separated. The normal food and hors d'oeuvres and things that you would have had normally, that was not there. Maybe a hug of congratulations to them and their family members, that didn't take place. And so by keeping our distance, changing the duration of time, so you'll look at the wing commander's list, he talks about circulation. If you notice, Sergeant Stewart was talking about he was in a room that wasn't circulating with other rooms in order to keep any of the germs or any of the droplets or anything around him with him. If we have to have a larger group, we're trying to do that outside to make sure that we can keep that separation and to limit the amount of germs or droplets or anything that's transferred. We're also changing the duration. So we're trying not to hang out with people. If we did have to do a larger group, we're not doing it for 10 hours straight. It's 10 minutes or it's 5 minutes or it's as short as possible to get what we need done. And so the answer, and I hate to be able to say it, but I can't say, yes, you can have 10 or no, you can't. There are things that you're going to need to do, and it depends on what those 10 people are doing. You could have 100 people in a group being more safe than 10 people based on the way in which they're taking those principles and how close they are and how long they are and what they're actually doing. Are they wearing their masks or are they not? And so you've got to look at those 10 people, figure out what you want to do. If the thing you're doing is entirely necessary, and I can't say that, but you can, do it if you need to, but make sure you keep those principles in mind and make sure you make it as safe as possible. And I think that's probably what the general would say if he was here. Log back into my phone. See, it's not as smooth when I can't do the questions like I usually do. So, Sergeant Stewart, we got to thank you for sharing your story.
No problem.
They said it was incredibly brave, so we appreciate it. And thank you for sending that message. Our pool is going to open up at any point. So maybe. We don't know. So we're still trying to figure that out. There are some pools in the community, not here, but in other states. You'll see things going on in other states. Do not compare Texas with us. There were things that were happening in Florida that were not happening here in California, and people would ask on these town halls, hey, Florida is allowing people to go to the beach. Why isn't California? And the answer, first off, was I'm not the governor, and so we can't tell you that. At the same time, just because Florida opened up their beaches doesn't mean they wouldn't have gone back and changed that decision if they could. There's huge spikes going on because of some of those decisions. And so we're working, the lap pool is open because we can actually separate people and we can keep social distancing. The hardest part to keep a community pool open is how do you keep kids from playing and having a great time and being close to each other. That's a fun place to be. I think, a couple sets of adults could easily sit at different ends of the pool and hang out. But then how do you set that up? I've seen a few pools that set up appointment times so they keep the amount of people limited. And so both the Wing, FSS, and Corvius, because it depends on which pool we're talking about, and Public Health, of course, are all working through those ideas. So I hope that we can open up the pool at some point, but I can't speak for the General or Public Health or FSS. Do you guys do you have anything you want to add to pool stuff?
Yeah, I could not really adding, but just echoing that. So we have been working close with the FSS. A lot of it depends on what the situation is on base and then some of the options for doing that type of thing. So the hard part is, like Chief said, the separation is really difficult to police and then getting a solid system in place that everybody stays safe because we still have to do the separation unless you're in the same household, but we have to do the separation. We have to do the mask wear as appropriate, obviously not when you're in the water. And then a lot of the things that you see at the lap swim pool, it's just figuring out how to apply that to the outdoor pools and applying it in an appropriate way that's also safe for the community.
So one thing I want to bring up, when we first went into this in March, everybody was very freaked out, and rightfully so. because we didn't know who had COVID and who doesn't. And still, as people will talk about, some people are asymptomatic and you have no idea. So they feel fine, but they could be carrying it everywhere. But we were really worried, and I don't think a lot of our people would have gone into a pool in March if the weather would have been right, because they were worried about everybody else that was going to be there. Now it's an even worse situation. It's better in the sense that we know more. We've got our masks, we've got PPE, and we've got ways of helping reduce that risk. But the chances of people around you in that pool having it are much higher, exponentially higher than they were, and they're not going down anytime soon. And so the risk is way worse than it was in March or April. But I think because of the duration, everybody's getting antsy. I had really planned on taking my kids to the beach last weekend for 4th of July. And even if I was going to try to find a socially acceptable and distanced beach, and I just wasn't able to do that, they closed all the beaches down for that very reason. And so I had to modify my plans, and it was unfortunate, but all of those things that we were doing in March and April, and we've got to continue working on. I think we're just doing them a little bit more smartly than we were. But as soon as we can do it safely, man, we want to get the pool open. I want to go. My kids want to go. Your kids want to go. It's so nice outside. I would love to be doing that in a pool. Maybe I'll buy one of the ones from the BX and put it in my front yard or backyard until Corvius gets mad. But there's alternatives. And so I'm going to have to run around in a sprinkler or do something different until that happens. Okay, next question. First, I think this is a multi-part question. So can leave now be taken, and does it require commander approval? So originally, we had information from the Secretary of Defense talking about travel. He has kept a lot of that document, or the rules the same, especially if you're in a red state, which we are still. It's different for green states, but for us, we still have to have approval for any sort of military essential travel. So let me back that up. Military essential travel like TDYs, deployments, those sorts of things. However, the Secretary of Defense came out and said, if you are taking leave, this rule does not apply, which means yes. Anybody here is allowed to take leave. However, squadron commander has to approve it. So you're not allowed to send it down to a staff sergeant or tech sergeant. Can't approve that leave. It has to be done by the squadron commander. And then the requirement from the wing and the SecDef as well is you have to have, if you are a squadron commander or a director, you must have a conversation with your airmen about what they're doing. For those of you who don't know, a lot of the time, especially if you're a young airman, when I was 18 and I wanted to go a couple states over during my leave, I had a supervisor who would sit me down and ask me, how are you getting there? How long do you plan on driving? Where are you staying? How's your car? Have you checked the oil lately? Walking me through all these things that I may not have thought of regularly to make sure that I was mitigating risk appropriately. And so we're doing the same thing. The squadron commander is allowed to approve that leave. However, they have to have that conversation with the member. And it's not just members who are 18 years old. If I go on leave right now, General Higer will sit me down if he approves it, and he will sit me down and ask me those types of questions. Where am I going? What am I doing? Let's say I have to go to LAX to fly. What kind of risk am I exposing myself to, and how am I going to mitigate that risk? And we will have that discussion because he is my supervisor. And so that is the requirement across this space. But leave is approved. And then there was another with your director or commander approval. This says, and I'm going to quote unquote, because this is what it says. It basically asks, are we going into Charlie or are we going into Delta? It says there's speculations. You can hear all the speculations you want. I sit next to the general every day, and he is not speculating that. Those are options that are still available to him if need be. But while things are going up in the local area, the general has said it many times that the risk is going up and the numbers are going up, but our ability to deal with it, because we are smarter now and we're a little bit more aware of what's going on, has helped mitigate, even though those numbers are going up. However, if at any moment, and I don't mean like moment in 5 minutes, if any day we wake up and all of a sudden risk is going up because the numbers are spiking and we as a base are unable to deal with it, those are options that he has in order to keep everybody safe and keep the mission safe. And so, yes, there are bases all over the Air Force. Some had to go down to Bravo and then went right back up to Charlie. I haven't seen anybody go to Delta. Are you guys tracking on anybody?
Nope.
I haven't seen any bases at Delta, but that is within every installation commander's purview to make that happen if they feel that it is necessary. But if you're worried about, are we going to any of these today? No, I haven't heard any of that information. I was with the general about an hour ago. But if things change tomorrow, that is something that he could do. So please try not to speculate. I know everybody wants to, but just keep being safe with what we have and watch the numbers and watch everything. And we're going to be on here every week. General had said before, hey, if for some reason we did need to go into Delta, he wants to give everybody a couple days so he could see everything moving up. Public health would have to, make that advice or give that advice. If he saw it moving forward that way, he said, if at all possible, he's going to come on here, talk to everybody, let you know exactly what's going to happen, and give you time to get situated, especially if anything got locked down because of it. Because we haven't had that 2-day notice, I think we're probably going to be all right for a little while, but just keep an eye on things. Go to the next question. When or how will a decision be made for Charlie? Okay, so it's pretty much, sorry, I didn't see this question before I answered the other, but it's the same. All of that is based on a lot of factors. Everything happening in the local population, what's happening on base, the different spikes that are happening, bed space and ICU space across is a big deal, our access to PPE, all of those things go into the calculation. And what are some other things that you guys are using as public health to make recommendations of, how would you say, or what would happen for you guys to have to say the risk has increased?
Yeah, so there's a couple things that we look at. Big things is going to be the numbers. So it's what's happening in the local community and then also what's happening on base. So we look as far as LA, we look at the state of California. We're comparing even nationally, what are we seeing there? Because usually we're just a microcosm of what the nation is doing and what California is doing. So we'll look at the numbers, we'll look at trends in the local community. We look at the same things that you had mentioned as far as like bed space, what's going on there. We also look at base though. So we look at what's happening on base, what trends are we seeing, particularly and especially right now, what behaviors are we seeing? Are people actually adhering to what they're supposed to do? Are we hearing reports of parties, things of that nature? So just like how you've seen the local community, how the governor had to change basically his stance because of these behaviors, and how we're seeing things in Florida and Texas and Arizona, and then different age demographics getting involved. So we're looking very closely at that, and we're trying to see how does this apply to Edwards? Are we seeing the same trends? Where do we go from there? And is there any way that we can intervene if we do start seeing these, especially negative behaviors and pro-COVID behaviors? Is there any way that we can intervene, or does it actually require that next step up?
No, that makes sense.
Yeah.
What about question for you guys? Antibody testing. When are we going to start doing that on base?
Colonel Westy?
Yeah, so for antibody testing, we're not doing that right now, and there's no expectation to do that in the near future, anyways. The CDC has not recommended that, and there's at this point no real use for it. The antibody tests are not been really approved, so there's no real guidance for its use. The antibody test will really just help you know if you possibly had COVID in the past, so it's more informational, but antibodies can fade out over time, and so even if it was negative, doesn't mean you didn't have COVID in the past. And the other part is if you have COVID now, it takes time for the antibodies to produce, so it doesn't really give you very good information. And the primary reason we're not doing it is because there is no known proof that if you had COVID in the past that you're immune to it in the future. So it doesn't really give you very viable information. Just like Master Stewart mentioned that he's worried that he could get it again and go through this experience again, which is exactly why he's still doing the social distance behaviors and following the guidelines, because he does not want to get that disease again. And that's the bottom line, is even if you had it, there's no proof that you won't get it again. And actually there's some case evidence that people are getting it again, so despite having had COVID in the past. So the antibody test really at this point is not very useful information.
So if you look at the four of us, the only person who probably, or the person who's closest to possibly having antibodies is Master Sergeant Stewart, and he's actually the one who's being the most careful about this. And so I think that's a good example to follow for everybody. Ma'am, another medical question. Can mission essential personnel go to the clinic on base to get tested just to make sure they're not carrying the virus?
Yes, so we can perform tests now. We do have a little bit better capability than we did back in March and April timeframe to be able to perform the test. We're right now not testing people out of randomness. So at this point, it is still, the focus is really still, if you're feeling like you have symptoms and you're concerned you might have COVID, go through the primary care doctor. And through calling the appointment line. If you're concerned that you may have had a close contact with somebody that was a confirmed case or a COVID case, the recommendation is to call public health, or you can go through the appointment line to get in contact with public health so that they can do that assessment and provide that recommendation. We are starting to do some surveillance testing. We're going to start in the future to do that, but that is something that is more a commander identified and more of a commander program to provide them some valuable information for their workplace. So it's still the recommendation is if you're concerned to call the appointment line primarily and talk to your primary care doctor or talk to public health to kind of get a better assessment.
Ma'am, I know we're going to get questions, so you just said surveillance testing. What does that mean? No, that's okay.
Okay.
People are going to want to know.
So surveillance testing is really trying to kind of cast that net out, and primarily in workplaces or in settings where you kind of want to know early on if some people may have COVID, because like Chief mentioned, you can be asymptomatic and still transmit that virus and have that virus and transmit it to people. The symptoms can be, for COVID-19, can be can be no symptoms to mild, to severe symptoms like Sergeant Stewart had, to obviously dying from COVID. So the concern is to try to attack at this a little bit and to get that early notification and that early knowledge if somebody may have COVID, especially in that workplace. Is to do surveillance testing on a regular, repetitive basis, and to kind of survey and kind of cast that net out to see if somebody may pop up positive and may not know it but be in the workplace. So that's really where the surveillance testing comes in, and that may be a helpful tool for us to be able to get back to full capacity and return to work if we're able to kind of have that program. It's not a huge number or percentage of people, but it's just kind of surveying and doing a little bit of surveillance testing, mainly to kind of get almost to get to that prevalence of what COVID might be on base. So getting some sort of prevalence number, which we have not been able to obtain at this point. So it's to kind of get that prevalence rate for the community.
So someone's asking, have the numbers or have the case numbers on base increased? I won't make you answer that one, ma'am. So here's what I can say. So we're not allowed to give specific numbers. There have been a couple times where the general has provided some reference, not numbers, but reference cases. So I can tell you 2 weeks ago when I pulled the Air Force numbers, it took the Air Force, and I'm making up the number right now, but it took the Air Force about 3 months to get to the number that they were at the time. And I just don't want to make it up for you. But within the week after that, the numbers went up 50% in a week. And we're seeing the exact same thing in California and in Florida. And so those numbers that you're seeing going up across not only the states, but the military, and you can see those exact numbers because the DoD and the Air Force releases them, we're seeing the same things on base. And so we do have cases that we did not have 2 weeks ago. And so you have to assume, and the way I assume that everybody around me has COVID, because they have it and they've recovered and may have antibodies, may not. They don't have it. They have it and don't know, or they have it and are sick and are not telling us. There have been a few people who have come to work not feeling well. And so we've told them, and public health is reminded, and supervisors are saying, if you don't feel well, you stay home immediately until we figure out and can prove that you're okay. And that's one of the best uses of those test kits that we have. And we've said it many times, is there anything that you would do different if you knew people had COVID as opposed to not? And so I think if you just if I assume that the captain next to me has COVID, well, I'm not going to give her a hug. It's just, sorry, ma'am. I apologize. But no, and I'm going to wash my hands, and I'm going to wear my mask, and I'm going to do all those things that I need to do anyway. And so it's unfortunate. It limits the amount of connections sometimes you can have. It changes what we do day to day, but it's important. If you don't get anything away, or if you don't take anything away from Sergeant Stewart's story, take away that it is important, not just for you, but for the people around you. Go to the next question. I remember it. So if people deploy when they come home, do they automatically have to quarantine? And the answer to that is no. Now that doesn't mean, so I've got a member from one of my units coming home here really soon. So I talk to public health, and we look at where has that member been? What has that member been doing the past week? How does that member feel? Did they get stuck at an airport somewhere and they were sleeping in the airport overnight? That's a different risk than flying home, even through LAX on a plane with 4 or 5 people. And so it's a case-by-case basis. If the director or the commander feels that they need to self-quarantine for a little while, that's okay. It's probably safe to go ahead and do that, but that is not a requirement for the wing. What kind of things would you, as far as coming home from deployment, ma'am, what kind of things would you recommend people going to quarantine if they're around or dealing with?
So one thing that does happen now is because the DoD put out this COVID guidance as far as coming home, what do we do with deployers? How does this work? Because each situation can be very, very different depending on where they're coming from, what's the point of entry, how many layovers did they have, what was their exposure when they were actually at the base. So what happens now is that whenever anybody somebody comes back home, they're going to in-process with public health, just like how they normally will, but we're going to ask them a screener question. So we're going to be like, we're basically going to give them a mini risk assessment like we would give anybody that was like, hey, I was exposed to COVID. So automatically we'll ask them, hey, what was your exposure? What was your, did you have any COVID cases on base? Did you ever go out in the local community anytime recently? Back at their deployed location. We'll ask them, hey, what was your mode of travel getting back here? Were you living out of an airport for 2 days? If so, what type of stuff did you do and stuff? So we asked them a complete history of that to include, were you ever exposed to COVID, or what was your job? Again, the local community thing's big, especially for overseas bases. And then obviously the travel. Did you just get to hang out in Ramstein for a week, or were you in like some airport in the U.S. that's super busy? What were the policies on your plane? So we asked them all of that. So, and based off of that, we give our recommendations just like how we would a normal person that came to us, or someone that wasn't deployed, or someone that may come from overseas and was concerned. We give them the same recommendations we would as far as like, hey, we recommend you quarantine, or like, hey, are you sick right now? We even ask them that, and they're like, if they say yes, and we're like, all right, we're gonna probably get you hooked up with your doctor now, and then you might be isolated, and they kind of go through the normal pathway from there. But we just basically do this initial risk assessment. We're also going to be available on our on-call phone for deployers only for the weekend, so they don't have to worry about quarantining over the weekend, not knowing, hey, am I gonna have to be quarantined or not? But just like how Chief said, a lot of that's going to be on the supervisors as well. So if we say, yeah, you don't really meet the indication for quarantine, supervisors can still, out of an abundance of caution, absolutely say like, hey, or commanders can, hey, I think you should stay home. We're gonna do it this way. But that's basically what we're looking for, is just mode of travel. What was your exposure to other people? The same thing we'd be looking for stateside or on Edwards or any other situation. It's basically similar questions.
Okay.
Yeah.
Thank you, ma'am. And just to remind everybody, this is a wing town hall. It's not a COVID town hall, so we can talk about COVID. If that's all you want to talk about, awesome. We will talk about anything you want. But if you have other questions, we can answer those too, or we can try. Another question for you, ma'am. Can you guys elaborate more on the COVID testing across the wing? Is it going to be random? And then are we going to target specific activities? Like if everybody goes on a TDY, are we going to test all those people when they come back from the TDY?
I'm going to say no. So no, not necessarily. Right now, like I said, it's mainly based on if somebody was symptomatic, that they would go see their doctor and get tested. If the primary care doctor felt that that they needed to get tested based on the symptoms. We are testing people who are close contacts of confirmed cases. So that's where public health has stepped in. And if there's a confirmed case, they will do their contact tracing. And the contact tracing, again, begins 2 days prior to when that person became symptomatic with COVID, and then they will do that contact tracing, and people will be quarantined based on that, and we will test them, test those close contacts at that point, and then also test them at the end of quarantine, and go from there to make sure that they're returning to the workplace and without COVID. It is a little bit voluntary at this point, but that is what we're doing. And then we are also starting, we haven't really, it's guidance that is just coming down recently, and they're redoing some of the guidance that's coming down. But we are starting to go to do surveillance testing, and we are trying to prioritize a little bit to the high-risk areas. So like the medical group and people that work with patients, the clinical staff, dorm residents, because they're living in shared facilities. And so they may be a little bit of higher risk groups. And so we're going to look at different areas that may be at higher risk to offer the surveillance testing. But the surveillance testing is completely voluntary at this point. But those are things we are starting to do as our capacity for testing increases. But it's still really in the initial phases. And this is something we're trying to do really that marathon for, and trying to plan and plan it smartly from the first, and then go from there.
So for the surveillance testing, is it the fun one where, they get to scrape some brain?
So the good news is we are trying to make it a little bit more pleasant. So at this point, we are doing the nasal wash. So it's actually kind of like you would do your neti pot, kind of saline irrigation to your nose. So it's really not as uncomfortable. I had it done myself, and it was actually quite pleasant because it just cleared you out. Like if you're swimming in the ocean, got the salt water up your nose. So right now we are doing the nasal wash samples for the surveillance testing. For the other tests, there's nasal washes, but we also have a swab where we are just doing the anterior part of the nose, so it's not the brain sweep. There is another test that we do that is a little bit more as a brain sweep, and those, of course, if you're I don't want to scare anybody.
Is that the clinical term for it, ma'am?
Yes, that's exactly the clinical term. Yes, sir. So if you are symptomatic, then that may be something that you may be getting is that nasal pharyngeal swab, because then we can get that test done earlier. So our lab has capability right now to have a turnaround time within about 24 hours. It's a little sooner than that, it's 45 minutes, but obviously it takes time to process and everything like that. So we do have the capability of having same-day results, especially if you're having symptoms. They may test you with that test, and so you can get the test results in the same day. So we are trying to increase that capacity to be able to provide that information and real-time information so that we know right away if somebody has it or not.
One question, ma'am, for you guys. So can public health send out the screener questions that you guys mentioned? So sponsors, chiefs, commanders can ensure, one, they're kind of knowledgeable and asking the question, and then they only give to you if they go through that, probably a decision matrix. If yes, then probably you need to talk to public health. Is that something you guys could send out to leadership?
Yeah, we can definitely develop something that's like a quick reference guide to be able to get out to leaders. That'd be pretty easy.
I think it'd probably limit one. It would spread awareness for all of us, and then when somebody gets to you, it's real. One of the questions we got in, you may know the answer to this, may not. So they asked about if you're severely sick, which ICU or where do you need to go into the Valley? And I know the answer is not our medical facility on base. So
Yes.
where do they go?
I would recommend going to Antelope Valley Hospital. They're the primary hospital for the Antelope Valley area. So that would be where I would go if you are really, really sick and needing medical care right away at Antelope Valley. They have ICU beds set up for that.
The follow-up question that somebody asked was, are visitors allowed at this time? And I think that's something that only the hospital can answer. And it's probably based on the ward and the building that you're talking about. And so that's something you'll have to talk to them. If your worry is, I don't want to put my member or family member in the hospital because visitors aren't allowed, I would ask you to think about that for a moment. And if you listen to Master Sergeant Stewart, you need help as much as possible, as quickly as possible. And it will be unfortunate and it will be boring. And it's hard to watch a family member deal with that alone, but at least they would be dealing with it with a team of experts around them. The reason you can't come to us as far as on base, we don't have ICU capability. And so our ability and everything we do is to get you to that ICU as quickly as possible if you have something that we have to use our ambulance for. But we are not that type of facility, and we need to get you with an expert as quickly as possible. So please get down to Antelope Valley or see if we need to help you get there. If a spouse is required to quarantine, is the other spouse required to quarantine as well?
Nope. So if one spouse is quarantined, so the definition of quarantine is you've had an exposure. We don't know if you're actually going to get sick from it or not, but the intent is to keep that person away so that if they do get sick and develop symptoms, they're basically a dead end for contact tracing. So that person will not be out, will not have any contacts from that point on. So they're just hanging tight for that incubation period. If they don't get sick, cool, they're good. If they do, then there's no one else that they exposed, except in that case. So if someone is quarantining at home, it's fine that their spouse is going out and about. The only risk there, if you do have somebody else in the house that's not currently quarantining, is that if that first initial quarantine member does start to get sick, obviously the spouse or whoever is living or is cohabitating in that home will most likely be put on quarantine because now you're going to be a contact of an actual case. So kind of like it domino affects it down a little bit. There is an important thing though, if you are going to be quarantining with your family member, a good way to help prevent them from getting COVID, if you do have if you do end up getting sick with the disease, is make sure that you're trying to social distance from the rest of your family as much as you can. Make sure you're wiping down everything in common areas, and honestly, you still doing mask wear, even though you're in the same family. That's still ideal for preventing the transmission of the virus if you would become sick. But again, to loop back around, the other family members are not required to also quarantine because they weren't exposed to that initial exposure. They're kind of a contact of a contact.
So you got to look at how close you are to the person. If you're right next to the person with symptoms, then you need to be careful, but you're not limited in everything. However, if you become the person with symptoms, then everybody else that was 1 degree now becomes one step closer.
Yep.
So that's been a hard one, and it changes. So, but the main thing is, if you feel sick, if you feel anything, and the weird thing is, I get hot one day. I'm like, you start freaking out a little bit and wondering. But if you really are sick, stay at home and then call public health and get help as quickly as possible. I'm checking to see if there's any questions that came through. So I think it's probably about time to wrap up. I'll check while you guys are talking. But do you guys have any final thoughts? Sergeant Stewart, anything you want to give to the audience?
I would say with the quarantining in the house with your spouse, if you're sick, if someone is sick, or has symptoms, just assume you have it, because I was told I had upper respiratory infection, right? And lo and behold, I didn't. I had COVID. So my whole family was exposed to it. So just take precautions and take it serious. Just don't assume it's the allergies or something like that. Just take it serious.
No, thank you. Ma'am, anything from you?
Yes, I'm going to echo Master Sergeant Stewart because I think he's spot on with that. You at this point, as the cases are rising in the community, there is known community transmission, and we've been going through some cases, and some people really don't know where they got it from, and so you just can't presume that you're going to know. So you really have to be on guard still. The cases are going up higher in the community. Death rates are going up. Hospitalizations, they're starting to get full capacity in some of in the hospitals. So it's right now is really the time to hunker down and know those social distancing behaviors and follow the rules for that. This is not as things are trying to open up. They're opening up because of those mitigation plans that were put into place. But the intent is to be able to provide services with the mitigation. The intent is not to just throw everything out the window and feel like it's gone, because COVID is definitely more in our community now than it's ever been. So if you do become sick, if you do have symptoms, you really should assume that you have COVID until really kind of proven otherwise, and stay at home. Don't go to work. Don't go out into the community where you may be spreading that, COVID around to other people. So, or that possibility of having COVID around to other people. So if you're feeling sick, the best thing to do is stay home. And I can guarantee your supervisor will support that 100% at this time. So that really is the guidance. We're still, part of the community. We're still wanting to have fun and do things, but it's not about not being able to do that. It's just really about what you do to mitigate your risk to yourself, to your family, to your loved ones, to your friends, to your community, and that's really the bottom line.
Anything from you, ma'am?
Yeah, just one final echo, and I've said this a lot at the medical town halls, if anybody here has been watching those, but really want to focus on personal risk communication, risk assessment. Right now there's a lot of stuff going around the news about different states, what different states are doing, whether or not they should be doing different opening up activities. No matter what happens on the outside or is happening in the local community, please make sure that you are making those good risk-based decisions for yourself. So just because, let's say just because bars reopen, is it really a good decision depending on what you know, what you've been educated on from these town halls, from what you've seen posted on base and all the good reputable sources like the CDC and places like that? Just please make sure that you're still doing that individual risk-based decision, because regardless of whether it happens in the local community or not, doesn't necessarily make it that it's right for you to go out there with your family. Because like Colonel Westy kind of talked about, everybody has to be doing these mitigation steps for it to work. And right now there are a lot of people that aren't doing these, and so that's why we're seeing a lot of the cases increase, especially in the local area. So please just continue to do that great risk assessment for you and your family, regardless of what facilities are open. Just look at how many people are in it, what are their mitigation steps, are people actually following the rules there, and do I feel safe before I go into this establishment or do this activity. So regardless of what's happening, please just make sure that you still do that risk assessment for yourself.
So I hate to echo from the echo that we're doing, but this is a serious thing. It gets weird because we've been doing it for a long time, and once you do something for a long time, you start getting used to it. Unless you've had COVID 5 times, you're not used to having COVID, and not many of us or any of us have that yet. But the one person that we have here, at least in this room, that's had it is one of our most careful people. And if he's being that way, there's a reason. He's dealt with it, and so I think we need to take advantage of the fact that we get to learn from Sergeant Stewart and learn from these public health professionals. I know, leave opened up, and we're allowed to take leave. I'm allowed to take leave right now. I haven't taken leave because the things that I want to do with my family, I can't do right now. And so the risk of doing something different is not worth it to me today. And I'm not saying you're wrong for taking leave at all. That's an assessment that you have to make, and it depends on what you're trying to do. But I want to take that leave later on when I can take full advantage of it, and my family can actually get the downtime that I need from that leave, because we only get those 30 days a year, so I want to take advantage of that. We don't have We got to jump off here in a minute. We're going to be here again next Friday. So we'll be here again. We'll talk about it. We'll talk about anything you guys want to. But until then, I want to say, first off, thanks. So hopefully many of you were able to check out the 4th of July fireworks that we had here. So that was Corvius, our CE group, our FSS, and our MSG. There were a lot of people that worked on getting that fireworks show done. So everybody could still have a really cool 4th of July event. I did burgers in the backyard, and then I hung out socially distanced from some neighbors, and we sat in the driveway and in the street with lawn chairs, and we had a drink and we watched the fireworks. It was a great show, and it was a great way to still talk to friends and talk to family, and remember what the day was all about, while keeping as safe as possible. This is not over, and it's not going to end anytime soon. I wish I was wrong. I hope everybody wakes up tomorrow and says that I was stupid for thinking this way and I was completely wrong. That would be a great feeling. But if I'm right, it's going to be around for a little while. And so find a mask that you like. Find a mask that you can wear all the time. Find a cool mask that's looks good on you and you appreciate. But wear it, because it's not this thing that you're going to buy and be done with in 5 days. And it's the same thing for kind of your daily interactions and your daily activity. One of the interesting things is a lot of this community, even though we've been distanced, has come together on a lot of things. And we're seeing people that we didn't see for a while because maybe we were all too busy. And so busy going TDY and going on trips and running and dealing with other things that seemed like a priority at the time. And maybe now, looking back at it, it wasn't as high a priority as we were keeping it. And so I ask you to keep working with your community, to keep helping us, not only by making good decisions, but helping us find better ways to do what we're doing. There are some of these things that we're going to keep around. Everybody always asks about telework. There are people who are going to continue to telework once this is done, because we found a better way of doing that job for the member and for the unit. And we're going to have people who aren't stationed here teleworking from other bases. That's awesome. We're going to have people who PCS from here as a military member, and their civilian spouse is able to keep their job because the job allows for it and they're able to telework. And so it is forcing us, which is a great thing, to try some things that we may not have tried otherwise, and we're learning a lot of great things because of it. But that's only because you guys have really been doing a good job with being open to trying new things, being okay with maybe messing up and failing here and there, and then learning from that lesson and moving on. And so that's what we do. That's what the test wing does. That's what the test center does. And that's what really the Air Force needs us to do, is to test those things, to find out what doesn't work, tell everybody those failures, and then move on quickly. And so I appreciate everything you guys are doing. If you have anything that you need, please let us know. There are a lot of ways to get a hold of myself and General Higer, and now Colonel Gordon, who's in the seat, public health. All of these people are reachable. And so I need you to, if it can wait till Friday, awesome, ask on this forum so a much larger audience can learn. But if it's something you need right away, please let us know. And that's all I have for you. I appreciate it, and I hope you guys all have a great weekend.